So this is
Okay.
basically my first port access.
Okay.
Now, is there heifer mixed in with that or no?
No.
Just
Mm-mm.
saline.
Just saline. Okay, so what I'm gonna clean it off. And then I'll put like my little sterile.
Okay.
I don't know if this might sting because you had a little incision right
Yeah,
here.
no, it doesn't bother me.
Yeah. It looks good though.
It's good. Like I said, I think the fall just
Scared you.
well, I think the way I fell, I hit the clavicle up on top,
Yeah.
and then I hit all those muscles that were already cut, and just made everything more
Now,
sore.
did you say they did try over there?
They were, yeah, they looked. They didn't cut anything.
Oh, okay. They just looked.
They looked
okay.
and they weren't happy
They
with
thought
what they
this was
saw.
the better.
Yeah. So they went to the other side.
Mm-hmm.
Because when I remember waking up and I was like, "You put it on the wrong side."
Oh,
And they
okay.
explained it to me.
Okay. Okay, now I'm going to put this on. Don't touch it, okay? Because this is what I call my sterile field. Because
Okay.
I'll lay everything on top of it here. I'll lay my... Because I want to keep this sterile.
Okay. How can you see what you're doing if you have a cover over it?
I don't have a cover over
Oh,
the port.
okay.
What I have to do is I need it, because you need to put it right in the center.
Mm-hmm.
Okay. I just want to make sure I can, because you have to stabilize the port too. Okay?
Right, so it doesn't move. That makes sense.
Mhm. Okay. Now, does this hurt me putting?
No, I mean it's sore, but
Okay.
I mean, don't get me wrong. I can feel it, but it's
Yeah.
nothing
Mhm.
I can't handle.
Okay. Here we go. Thought I had it stabilized there. It's that, or it's deeper than what I thought it was. Yeah, because sometimes there's some swelling here.
Oh, there's definitely swelling there. But I did remember them saying that they had to go deep for where they were
I
going.
had it. Thought I had it stood there. It's moving on me. Yeah, it keeps. It's deeper than what I thought. Yeah, it's not gonna work.
Are you kidding me?
No, what I'm saying is it's so deep. It's because, like,
Please tell me this was not all for naught.
no,
Okay.
what I'm saying, when they're first put in, you have this swelling when they're
Yeah,
first
yeah.
put in. So until we call it, the port has to mature.
Do you have like a longer needle?
Yeah, that's what I'm going to do. I'm going to get a longer needle here. It felt like it should,
Well, I knew there was swelling there. I can feel it.
Yeah. Okay. Because I went right in here. That's where the port like I says, I might need a longer needle, so I'll get a longer needle here.
Okay.
Because I think what happened is, gee, isn't that bizarre? It really.
Like I said, I don't think me hitting the floor helped.
Yeah, and there usually is swelling, but I mean, you're a trooper here. You're tolerating this really well.
Well, thank you. I've been through a lot.
Yeah. I was afraid the minute I put pressure on it, because you really have to put pressure. You really have
Yeah,
to.
I can feel. I mean, it's definitely sore. I can't raise my hand above.
Yeah.
You know, at this point, or use it. I
Yeah.
can't use the shoulder for anything, and that's my dominant hand. So that's
Yeah.
you know where I'm having issues. It's hard to believe that not last Saturday, the Saturday before, I worked for 6 months to stand up and dance with my son at his wedding with braces.
And then.
And then this. I'm back to square one. It's frustrating, and this is really frustrating. You get to the point where you wonder why you're trying so hard, you know? But I wouldn't have missed it for the world.
Yeah.
You know, it's a memory that I'll have forever.
Okay, here we go. Let's try this. I have a longer needle here now, so.
So it's got to go somewhere.
I mean, like, what I'm thinking is that my.
But there's too much swelling right now for the regular
Well,
needle
let's
to go
see.
in.
Yeah, well, let's just see how this is a longer one. So I'm hoping this will do the trick here. I think what happened whenever I press down on it, it's sort of like I lose the swelling, and then I think whenever
You get a little deeper.
I let up, then. Okay, I'm just gonna clean it a little more here.
All right. You must know I'm like, if anything odd is gonna happen, it'll be with me.
It'll happen to you.
My doctor actually calls me his 2%er. If there's a 2% chance of it happening to me,
It's gonna happen.
it's gonna happen.
Okay, now. I just wanna really stabilize it here. Felt like I did.
Now, when you do that, if somebody does it wrong, is there a chance of them going through it?
No, if you don't hit the center, you know it.
Okay.
Okay, well, that's what, like I says on this, I just don't know. I had it.
Maybe they put it in wrong.
No. I can feel it. I just you have to make sure you keep it from moving. Okay, this is one. I don't know. It's like whenever, okay, I think I'm in it now.
That'll pinch.
Yeah, there's our blood return.
Awesome. That wasn't
I
as
think
bad
it
as...
somehow moved on me whenever I, like it's just, like I says, there's some swelling in there and it can move easier. But once everything knits together in there,
It heals.
it will,
It'll
it'll stay
This
put
was just a
much
really
better.
bad time to
Yeah,
have to
that's right. Well,
hit
we
it.
used to have a doctor who, when he put them in, he wouldn't let you do anything with them for like a week or two.
Yeah, that's what I was figuring. I wouldn't need to use this for a couple weeks until I went to Pittsburgh,
Yeah.
and I'm kind of glad it was done here because if they would have ran into the same problem, I don't know what they would have done.
Well, where do you go in Pittsburgh?
Allegheny General, but it's the infusion center. You're not actually in the hospital
yeah.
part of it.
But I think they do work with ports.
Yeah, but
don't
if
they?
it would have been this swollen, then I don't know if they would have known to.
Okay. Well, you know what? They probably, worked with, fairly fresh
Right.
ports.
This is a very fresh port,
Yeah.
and then it had trauma on top of it. So
Yeah. I'm just glad that this.
you're glad.
Okay, and then they can take your blood work out of here too. Then.
That's fantastic.
Yeah. Once this, knits together, it'll feel a lot better.
Now does that stay on as long as there's an open port?
Yeah. And we need to keep, you want to keep this occlusive.
Mm-hmm.
Now, what I did put around there, it's called a bio patch.
Okay.
We put it around the insertion site. That's to prevent any infection from occurring. It's a chlorhexidine patch that.
Okay. Well, one thing I didn't ask them that I have a question on is when can I shower? Get it wet.
Okay, you can't, as long as the needle's in, you shouldn't be showering.
Okay. Yeah, they didn't tell me that either. So.
Well, unless you could cover it in a way that.
Right.
Because if it gets wet, then the dressing needs changed. But if that's what would end up happening, they just have to.
Can I just
yeah,
put the
clean
dressing
it,
on and?
Clean it and. But
That
if you
I should be able
can't
to.
keep it, like if it's accessed and you can't keep it, and it does get wet.
Yeah.
Like if you would cover it, and because it's pretty hard to cover this.
Yeah.
And like a pick, you can pretty much put a bag.
That doesn't even work for me. I've
Like
lost
this.
that many of them.
Yeah.
I think I look better with the mask on, as swollen as my face is from Zolumedrol.
Okay. It doesn't look bad though. Your face.
It does to me. Look like a pumpkin. It's really swollen up in the past 3 days.
Mm-hmm.
Y'all done?
It was a little difficult.
I had to do a second try because it must have moved on me.
Okay.
I told her the fresh ports are harder to stabilize, but yeah.
And there's swelling and.
Yeah, lots of different factors come into
Well,
play.
I had to use,
fresh.
then I used a longer needle and.
We're all
Okay.
good now.
Okay. Alright, then I'll be back in a moment. You didn't hook her.
No.
Okay, I'll be back in a minute and I'll hook you up there.
Thank you.
Let me just tape a loop here. And I'll keep this, I'll only tape on the dressing, okay? I won't use this tape on your skin.
Just as long as. Well, what's the top one for? Is there stitches up there?
This here,
Yeah.
I'm not sure if they have stitches or
I
not.
was just wondering why that was still there.
Well, there's an incision there, so
Oh, okay.
that's on to, that's on to protect the incision.
And that's what he meant, but when he said that not to get the stitches wet. But there must be one or two there.
The stitches must be there because they're not right over the port.
Okay. Well, thank you very much.
Oh, you're welcome. I'm gonna get another piece of tape for that loop to try and secure it a little better.
Okay.
You know what might have happened? Maybe that my needle just wasn't long enough.
Well, like I said, I can tell I'm swollen there as well. And it wasn't that bad at all until I fell. It was after I fell that everything went to
Yeah.
hell in a handbag. That's when I couldn't use the shoulder at all for anything, so.
Yeah, when you said it hurt, I thought, oh my, if I have to be, pushing on
See,
it.
that it wasn't too bad. It's like
Okay,
actually the
but that's
shoulder and the
what-
face.
Uh-huh.
The two
Like
places I
says,
hit.
that's what, now you know how it feels.
Yeah, that's
you
not,
know.
and it'll probably feel
This
better
can
once it
come up.
heals. It won't be
Yeah.
nearly as bad.
Right. Mm-hmm. Okay, then this can come up here but they can get your blood work out of there.
Now, when they're not using this, will they just tape it to me?
Hmm?
When they're not using it, will it just be taped?
Well, yeah, we could tape it anywhere.
I mean, I don't want it loose and hanging.
I could put another piece of tape right over top of that.
That would make me feel better. I've got dogs that like to jump on you. So I want to make sure that when I go home, it's not.
Okay, are you going to have, the whole thing is it going to be accessed when you go home?
I can't answer that. I don't know.
Okay.
It shouldn't be unless I need
Yeah,
to go to
mhm.
Pittsburgh or
Yeah.
come back in here.
Yeah.
So I'm assuming they would take it out.
There we go. I have it taped to that dressing
Okay.
there, so that'll.
All right.
Okay.
Thank you very
And
much.
she's going to be hooking you up there, so I'm just going to. Yeah, I'm going to look on your chart and see if they left any information there about your foot.
Yeah, that would be nice to have a printout or something because, like I said, I didn't really get a whole lot of information, and then
Well, when you were put to sleep.
well,
it's-
that and, but even the nurses and the doctors were all giving me different information. One told me that it had to be flushed with heparin once a week. Then one said no, it
it's-
was once a month.
It's monthly.
One said that I could be taught to do it myself.
It's
One
pretty
said-
hard to do yourself. I mean, like, because it's the the direction you have to be putting it down and stabilizing your port, and I would think it would be pretty hard, but I mean, I guess you could, but
I've learned a lot.
yeah,
In the past 10, 15 years, I've learned an awful
right,
lot.
yeah.
I can remember the very first thing I learned was how to turn off a bed alarm.
Okay, I'm going to put a cap on the side port because it won't be used. It's the other port that'll be used.
There's two ports.
There's a port here, and then
Is that
so I'm
just
just
in
gonna put
case
a
of
cap
two
on.
different medications?
if they want to piggyback something in, they could.
Okay.
But okay, but this is the port they'll be using for your infusion. So
All right.
just okay. There you go. All set.
Thank you so much.
You're welcome. Okay.
That's how it's done in under 20
That's how
minutes.
it's done.